Hello, my name is Scott Langston, and I'd like to welcome you to this series of videos exploring different therapeutic modalities, essentially the different types of therapy that I would use working with a client. And today's short explanation is about IFS, internal family systems. So, internal family systems is a very compassionate, non-pathologizing approach that helps people understand and heal different parts of themselves that carry emotions, beliefs, or protective roles. So, in essence, internal family systems operates around the belief that we're not a single unified personality. We are rather a collection of parts, each with its own feelings, needs to protect us. Some hold on to pain, some fight with each other, some feel ashamed, scared, or just exhausted or angry. IFS helps us to build a healing relationship with each of these parts so that they can move out of the painful roles and into healthier, more globally supporting roles. So, IFS was developed by Dr. Richard Schwartz in the 1980s in the USA. He observed that many of his clients would talk about themselves in therapy as having different parts. A part of me wants to speak up. A part of me is just exhausted. A part of me is terrified. There's this part of me that just keeps trying to hold everything together. There's a part of me that's angry, and so on. So rather than treating this language as metaphor, Schwartz recognized it as real and that it was a meaningful description of the inner experience of his clients. So he built IFS on the belief that all parts are welcome, all parts have good intentions, even if sometimes their strategies can be ultimately unhelpful. So, IFS is grounded in several key ideas, one of which is the multiplicity of mind. Everyone has parts, emotional states, roles, or fragments of experience that form a whole global system. All parts are good. This can be quite hard to understand in therapy, but even the parts that feel destructive, those that self criticize, that are to protect us in some way. In addition to these parts is the self. And the center of each person is the self. It's the calm, compassionate, confident core. When the self is leading, the other parts relax and healing becomes possible. Especially in childhood, when the self is developing and potentially quite weak, each of the parts steps into a role to protect us and maybe adopts a role that it was never meant to have, like guarding us from pain or holding shame. So IFS does not push the parts aside. It doesn't try to quieten their voices. It listens to them, supports them, and helps them to transform into healthier parts of the whole. They're not labels nor diagnoses. They're just a helpful way of understanding the different inner roles. So we have exiles, which, as the name suggests, are parts which carry emotional pain, perhaps lock it away, pain, shame, fear, trauma, and they are internally repressed. Sometimes you might hear people talking about healing their inner child. That's an aspect of IFS where you would heal a part. Some parts are managers. They like to be predictable. They like to keep us safe. They like to manage our emotions and our relationships. That might be your inner critic, that might be your sort of obsessive planner or the caretaker that's constantly looking after other people, the perfectionist maybe. Managers try to protect you from feeling hurt again. And again, sometimes the strategies they use are not in the long term very helpful. And the third category of parts is the firefighters. And these are the parts that intensely react when pain bursts through. They try to extinguish what is causing the pain or to numb distress. That might be substance use or overeating or self harm or rage. That might be dissociation or compulsive behaviors. Again, they're not bad, they're desperate protectors who step in when the exile parts are feeling overwhelmed. One of the most unique aspects of IFS is this idea of self. And the self can be described as calm, compassionate, curious, confident, connected, creative, courageous, and clear, what IFS calls the 8 C's of self-leadership. And it's tapping in and accessing the self that helps lead the healing process in IFS. So how it actually works in a typical session would be identifying the parts, noticing which part is speaking, reacting, or feeling activated. It's not always obvious, and you might think that you're operating from a place of self, when actually you're operating from a place of wounded inner child, for example. The next step, once we've identified which parts are speaking, is to befriend them, to approach them with curiosity, not with fear or judgment. And then doing something we call unblending, which is helping the client to separate slightly from the part so that they can observe it, maybe even dialogue with it, rather than feel overwhelmed with it. And once we understand that part's role, we can ask questions like, what is it you're trying to protect me from? What are you afraid might happen if you stopped doing this? It really is an internal dialogue. And then from a position of self, the client listens deeply to the part's story, to the pain, perhaps, to the history, and can identify perhaps outdated or outmoded beliefs that the part carries, like I'm not good enough, I'm incompetent, I'm unsafe, I'm always going to be alone. Things that maybe as a child you might have believed, and that burden or that outdated belief of the past carries on into present relationships. IFS helps parts to release these burdens in sort of symbolic or emotional processes. Once these burdens are released, parts naturally shift into healthier roles. The critic becomes a motivator. The perfectionist becomes a healthy planner. The avoidant part becomes a protector with more flexibility. There's a fair amount of research into the clinical experience of IFS, and it is shown very clearly to be effective for anxiety and depression and emotional regulation. It certainly helps heal trauma. It strengthens the notion of self-compassion. It reduces internal conflict. It improves external relationships and can create long-lasting change. Clients working through IFS often report a sense of inner peace and a sense of progress and clarity that they've never felt before, even if they've been involved in other therapeutic modalities in the past. IFS is particularly helpful because it's non-pathologizing. It doesn't diagnose, it doesn't label. It's deeply respectful of what's happening in your inner world. It's emotionally very gentle and powerful, and it's focused on healing root causes, not just healing symptoms. To summarize IFS in a simple sentence, I would say that every part of you is trying to help, but when the self leads with compassion, healing, and internal harmony become possible. IFS can give you a way of understanding yourself, not as a broken or flawed being, but as a beautifully complex and naturally whole, capable of healing from within. So thank you for listening to this brief video. Please click like and subscribe below and check back for other videos addressing other therapeutic methods.